While our politicians argue about how much each level of government should pay for our health care, other countries have done the legwork and come up with more efficient and more successful systems. Insight now, here's Deb.
Tony Brian Coxford is just back from a whirlwind trip around Europe. He and cameraman Mike Timbrell visited 5 countries and found solutions we might be able to apply here in every one of them. Tonight he takes us to France, where think about this being the case in British Columbia. There are no waiting lists. You need an operation, you get it. How is that possible? Here's Brian.
Racing through the streets of Paris, the elite medical team of SAMU, the top level of emergency care in France. It's virtually a hospital on wheels called to the big life-threatening events. On this occasion, an elderly woman has had a heart attack. They bring all the medical technology with them, hooking her up to monitoring devices just as they would in an emergency ward in a hospital.
This could be one of the best ambulance services in any health program. It's called SAMU, Service, Aid, and Medical Urgency. And with this team, there's a doctor, a resident doctor, a nurse, and a paramedic driver.
The team doctor's on the phone with another emergency physician at the dispatch center. She will find the appropriate bed for the woman in a hospital.
We are supposed to do the first treatment, stabilization, and then go to the right unit, emergency or cardiac unit.
This is Paris, one of the great cities on earth, a country where the healthcare system is ranked best in the world, where Parisians have discovered how to universalize the benefits of a competitive public and private healthcare market, utilizing the two systems in parallel, where the rich and poor share the benefits of both.
I think we have a very good health system. It's very good for the people. We still don't have this two-speed system. Don't care what your income is. You can get access to good doctors, good surgery, but it's a very expensive system.
In the operating room at Ambroise Hospital in West Paris, a woman undergoing shoulder surgery. There's no waiting list for surgery in France. One of the efficiencies in the healthcare here, she's allowed to bypass a visit to the GP, going directly to the specialist. She first saw the surgeon just a week ago.
There's no waiting, see what I mean?
Yeah, no waiting at all.
When they decide to go, everything is arranged.
En France, il y a une couverture sanitaire totale.
In France, there is total health coverage for people who work and those who don't. Those who work finance their social coverage from their salary, and for those who don't work, it's paid by the state or local collective. So there is total coverage for the poor and for the rich. And there is also the choice of health sector, public or private. That is to say, it's reimbursed in the same manner, whether private or public, except in certain private clinics, where if you ask for a top surgeon, you have additional insurance which could be charged.
In the French health system, surgery is performed 50% in public hospitals, 50% private. Health insurance is compulsory, and it's expensive. 20% of payroll, including a hefty employer benefit. The government-run French National Insurance collects it and is the single payer for services in both public and private hospitals. The choice of the hospital is left to the patient. That means the French rugby star getting an MRI at this private clinic in Paris has the same benefits. But he has extra insurance, as do 85% of French citizens. It gives them choice of surgeon, hospital, and type of room. That's why a man who works in London has returned home to get high-tech treatment for an injured foot, knowing he can get speedy access to quality care at the same private hospital as the rugby star.
You pay more tax in France for everything. Transportation is better and the health system is better in France. And in London, those two things are not as good.
We must say that the private system costs us less than the public system.
So that's the lesson.
At the end.
That's the lesson here.
The savings to the taxpayer is obvious. Private hospitals buy their own equipment. It's a huge saving to the health system. That leaves public hospitals to finance teaching, research, do the big operations and emergencies. The public-private combination here costs less. And there are other efficiencies in French health.
Here in France, when you go to the doctor, you pay the fee out of your own pocket. To get your money back, you have to submit a bill to the government. but you only get 75 to 80% of it back. It's a user fee to prevent overuse.
There are cashiers at hospitals to collect those user fees. And to make it easier for patients, French National Insurance has just issued an identity card. It'll soon come with a fingerprint and picture, making it easier to pick up prescriptions and pay fees. In the emergency ward, patients who aren't considered serious and don't stay overnight must pay a small portion of the bill. In the ER, more efficiencies. To prevent a backlog in emergency, by 2 o'clock every afternoon, a decision is made either to send the patient home or onto a hospital ward.
That's what you do here.
That's it.
And it works.
I think it works, yes. You didn't see patients in the corridors, didn't it?
Yeah, they all have beds.
That's it.
At public hospitals, the big surgeons see their patients on site rather than at a private office like they do in Canada. It saves money and keeps the specialists available at all times.
That works.
Keeps doctors in France as well?
Yes, that's a good way to be sure that in public hospital you get the best medicine, best surgery.
Here in the City of Light and the rest of France, the French pay for their health care as a percentage of their income. They pay less per capita on health care than we do in Canada. There are no waits for surgery here, and the satisfaction level with the public-private system here is high.
Our series continues tomorrow when Brian takes us to Switzerland. It's a country with no shortage of doctors or nurses. Wednesday, we take you to Germany for a story about running hospitals efficiently. Then to Holland, a country known for its liberal attitude and how that has translated into good health care. And finally on Friday, Britain, which like Canada also has a huge problem with wait lists, but unlike us, has come up with a solution.
Now we go back to the #1 priority in our country today, healthcare. Tonight we visit another European country that does it differently, and some would say better. Here's Deb with tonight's insight.
Tony, for years we've been hearing about Canada losing fed-up doctors and nurses to other countries, and it turns out some of them have been heading to Europe. In Switzerland, there's no shortage of healthcare professionals, and hospitals are everywhere. Now, the Swiss pay a high price for their premium service, but they wouldn't have it any other way. So what lessons can we learn from them? Here's Brian Coxford.
Our journey for healthcare solutions takes us to Switzerland. We're here at the foot of the Alps in the historic city of Freiburg. Swiss people have high expectations for medical care and its delivery, and they're prepared to pay a high price for it. It may look a little low-tech. In fact, we're observing a very delicate 3.5-hour operation where one of Freiburg's top surgeons is rebuilding a badly damaged ankle. And there's nothing low-tech about this OR. This hospital and others in Switzerland have the best medical technology and equipment money can buy. Some surgeons here earn as much as company CEOs, GPs over $200,000 a year, and top nurses about $90,000. There's no shortage of medical staff here, and this place is a magnet for caregivers, including a nurse from Canada, attracted by the wages and quality of care.
Let's say last week you had a diagnosis, okay? Within 2 or 3 days, within 2 days, you've got your surgery. Within 24 hours, 48 hours, you've got total orientation as to what you do next week.
The quality of care that patients are getting here,
It's excellent. Very good.
no waits for surgery,
No,
no waits for a bed,
no,
no waits for a doctor,
no. Everyone's seen and cared for.
and speedy.
Yes, very good.
In Switzerland, there's a mix of public and private hospital care, but it's mostly private, and many of those operations are done in public hospitals. You pay compulsory premiums for very good basic care, and if you can't afford it, the state pays for your stay in a public hospital.
So the patient basically gets an excellent care, and the fact that he doesn't pay private insurance does not mean there is two-class medicine, not really.
It's expensive medicine, but the Swiss like it. Surveys have put satisfaction levels at as high as 95%. Maybe it's got something to do with those fluffy goose-down duvets on the beds instead of those institutional covers you get on most hospital beds.
I feel really a little bad conscience that I use so much, and they all give their forces to me, and the hospital is beautiful. Everything is here.
Over in the private hospital, where you pay for extra comforts and a private room, more satisfaction.
I can tell you the staff and the doctors are fabulous. Well, this is a private clinic. It's not a hospital. You understand? That makes all the difference. The food is exceptional. Everything is wonderful.
The difference we do here in private hospital is that we are not, we have no problem with time. So if we want to do a knee surgery quicker and at a time perhaps in the evening or perhaps over the weekend, we can do it.
The Swiss earn 15% more than anyone else in Europe. Average salary here is $60,000. They know a lot about money because this nation of 7.3 million does the banking for some of the richest people in the world. For this small population, there are 400 hospitals. That's about 4 times more per capita than we have in Canada. And some Swiss are starting to think that's too many.
That's one of the grand difficulties and problems we have for all the ministers of health in all the cantons to reduce the number of hospitals. And many of my colleagues have already been or have no more been elected because they try to close the hospital.
In Switzerland, the level of health care is the best in Europe. By Canadian standards, it would be looked at as private health care. Here, no waits for surgery, no trouble getting a doctor, and there are plenty of beds in hospital. But you better have a hefty Swiss bank account.
Swiss Health is financed with a 3-way split of government compulsory premiums and private insurance funds. There are 4 levels of care with monthly premiums ranging from $200 to $2,000. High risk and older people pay more. The top insurance gets a private room, choice of surgeon. You can even get an operation out of the country. There are user fees for the lower levels on the cost of the hospital room, a trip to the ER, prescription drugs, and minimum deductibles on premiums.
That's one of our big problems, that these private insurances is getting more expensive and more expensive.
In this mecca for healthcare, insurance costs have risen 40% in the last 8 years, prompting insurance negotiators to think it's time to rein the costs in.
We can't just say we leave it as it is, because our system is a good quality system, but it's also one of the most expensive in the world. And we have to make sure, as I said before, that the next generations are going to be taken care of too.
This is the emergency room on the afternoon we are in Freiburg Hospital. There are doctors and nurses waiting for patients and lots of beds to accommodate them. They even have their own operating room in here. You'd never see this in an ER in BC or any city in Canada. For people in healthcare and those seeking treatment, this is medical paradise.
Well, that has been measured by some surveys and so on, and yes, that's right. And especially it was quite surprising because the people who are not so well in the country, who don't have so much money, they think we have a very good system.
Specialists here and in other European countries are on salary. That helps to control cost. They make extra money treating private patients. Swiss citizens pay more, but by many standards receive the best care in the world, and there are no waits. This in a country where the total cost of health care per capita is not much more than it is in Canada.
Brian's still working hard to put these stories together. Tomorrow, he's going to take us to Germany for a story about how to run hospitals efficiently. Then it's off to Holland. It's a country known for its liberal attitude, and that has translated into good health care. And on Friday, we'll be in Britain. That country also has a problem with wait lists, but unlike us, they've come up with a solution. That's tonight's Insight, Tony.
While our premiers ask for and appear to be getting tonight more money to fund health care, one European country is planning to ask for less from its citizens next year. Here's Deb with tonight's Insight.
Tony, when was the last time you heard of medical premiums going down in Canada? But that is, in fact, what's expected to happen in Germany next year. They are planning to lower medical insurance rates there because they've turned their system around to the point where even one of the country's public hospitals is making money. Here's Brian Coxford.
Open heart surgery is underway at University Hospital in Heidelberg. It used to be the wait for heart surgery was 6 months. Now, because of innovative changes to achieve efficiencies and accountability, it's now down to days. We're in the oldest and one of the largest public hospitals in Germany. In the OR today, 100 operations will be performed. Pacemakers are being installed in 2 patients, and a live organ has just arrived from the northeast part of Germany, and they're prepping for a kidney transplant up the hall. This is a country where no matter what your lot in life is, you get quality and speedy care. In a private hospital across town, a knee operation is underway. Private care accounts for about 20% of the health care here.
We are not supported by state, by taxes. We have to earn our money by ourselves and to keep the house and to go on doing the best surgery we can.
This is historic Heidelberg, where the competing public-private healthcare system is respected for its efficient delivery of care. And in this community, there are some pioneering initiatives that are keeping health costs in check.
I think both systems have a role. And I think the public system at the moment is under big pressure because we have a total change of the financing system.
The buzzword for the treatment of patients is DRGs, Diagnostic Performance-Based Funding. While German hospitals used to be globally funded according to patients and beds, hospitals are now being paid based on the quality and speed of the care. Those efficiencies have actually resulted in this public hospital turning a profit, unheard of for a large teaching and research facility, and there's more savings on the way.
The insurance company has announced at the moment they will decrease in 2005 the rate per patient from 44% to up in almost 40%. So this is really a success.
So the cost of the patient is going to go down?
Right.
And insurance payments?
Right.
Because of these efficiencies?
Right.
In September.
This is central booking, where a program called One Door has been introduced. A doctor, nurse, and secretary have total control over surgery bookings. Doctors and patients have to call here. Cutting through the red tape has resulted in waiting lists going down to nothing.
If you build or construct a car, then every process is very well planned and terminated so that you, within 4 weeks, you can build this car. And in a way, we have adopted these business strategies, planning strategies into the hospital by very carefully planning the day of admission, the day of surgery, whether the patients need intensive care, and then also the discharge of the patient. Where is the patient going after the surgery?
Germans pay compulsory insurance based on income. It's 14% of payroll, and those who can't afford it get the same care. Higher earners can opt out of the public system and go to the private insurance. And there's a user fee, 10 euros or about $15 to see a doctor, to a maximum of 40 euros a year. This is leading-edge technology, an MRI that just focuses on the heart. It's in one of the most advanced private hospitals in Europe. There are 4 MRIs here. Surgeons have them in their office.
The patient comes. Very often they come with an MRI, but if they don't have an MRI, or you have additional question, you need one, we do it right away. Within the next hour, the MRI is done.
They do all kinds of operations?
All kinds of operations. We have, for example, in this private clinic here, we have about 15 different specialists. We have a shoulder specialist, a knee specialist, a total hip specialist, a spine a neurosurgeon, and so on.
And you do heart operations? And
No, we don't do heart operations in this private clinic. There are other private setups in Germany who do heart surgery, open heart surgery and so on.
Open heart surgery and cancer treatments.
Right.
At the private hospital, the top-level private insurer gets the gold card treatment, from comforts to technology.
The infrastructure of Atos Clinic is fantastic. It's a friendly team, very competent in all areas. Not only Professor Pessler and his surgeons team, but also the after-surgery care gives you the impression to be in very, very good hands.
Any type of equipment, no matter how expensive, the patient only pays the cost of the equipment. German law forbids any kind of markups passed on to the patient in either a public or a private clinic. And that also includes drugs. And that law keeps the cost down.
Improvements in technology and those efficiencies will allow public hospitals to cut thousands of beds across Germany. They aren't needed, and that's more savings in the system. In the field, German doctors travel with the ambulances when there's a serious case. Hospital doctors and specialists are on salary, and in the German system, they can increase their earnings by working in the private sector.
And Brian still has 2 more specials on this topic. Tomorrow, he takes a look at Holland, where the relaxed Dutch attitude translates into a healthy system. And on Friday, Britain's solutions to a wait list problem that was as serious as ours. Perhaps a little more efficiency would do our healthcare system some good. The Dutch have adopted it as a means of fixing their healthcare, and as Brian Coxford reports, it appears to be working.
It's the city of bicycles. Pedal power is the best way to get around the narrow cobblestone streets of this crowded European capital. Cheap, reliable, and a healthy alternative to the car. Just ask your family doctor about the merits of making a house call on 2 wheels.
Twice per day, 3 or 4 visits per day. Generally at noon.
The Netherlands' 17,000 GPs still make house calls. In fact, it's a requirement. It's usually to the elderly or very sick, those who can't make it to the doctor's office and would otherwise crowd a hospital.
They're in their own home, and this gives confidence. It's always much more threatening for people to go and see a doctor in a hospital or in a clinic. And I really, this is one of the reasons I became a doctor. I love to see people in their own surroundings.
In Amsterdam, there's no excuse for not being fit. In this charming city of canals, you're either walking or riding a bike. Like other countries in Europe, health premiums are compulsory in the Netherlands. They go up with income, with higher earners having to take out private insurance, which accounts for 30% of the medical care. The higher premiums are tailored to supplement equal care for those who can't afford the insurance. The Dutch, like the French, are moving to a single compulsory standard insurance with both public-private care. The emphasis here and throughout the European Union is to look for efficiencies, find innovative ways to keep a handle on costs such as performance and quality-based funding. At OLVG, the second largest hospital in Amsterdam, Netherlands Health is allowing the heads of surgery to literally put their fingers on the pulse of hospital spending. They've been given control of budgets, meaning some middle managers had to go.
We can decide if we spend part of it on personnel, or part of it on equipment, or part of it on training. So we can decide more. We are more responsible ourselves compared to the past, where the board of directors was responsible for sharing the money, and you never knew what you spent a day. And now we are more aware of the costs we are making and the income we are getting from the patient. There's not anymore the bureaucrats or the administrators.
Cut out the middleman.
No, exactly. That's what we
making it more efficient and less expensive.
Exactly.
You'll see patients waiting in the lobbies of Dutch hospitals. That's because specialists see their patients here rather than in offices elsewhere. It keeps the surgeon on site where they're more valuable. It's also a cost-saving measure to the system. Another saving was achieved by creating co-ed wards, men and women together in the same room. It allowed for more effective use of the beds and also changed attitudes on the wards.
The attitude of the males and females changed. The more masculine attitude of the males in the room towards a nurse declined, definitely.
So you understand and you don't have any problem with co-ed rooms?
Oh, I don't know. I have not a problem. Maybe other people, it's a problem, but I don't.
Ambulances here come with a paramedic and a nurse with at least 10 years' experience. And when they bring an accident victim in, they're all treated the same.
Here in the Netherlands and in other countries in Europe, there's no distinction between lifestyle as to how you're treated in hospital if you're hurt. For instance, if you're hurt in a work accident and you need surgery, you get speedy care. On the other hand, if you're hurt in a recreational endeavor, you fall off your bike, hurt in a traffic accident, and you need an operation, you get the same speedy care. Unlike in Canada, where the person hurt outside of work has to line up and wait with everyone else.
Get the care you need.
And the belief there is that everybody's the same?
Yes.
And that A person who is injured in recreation is out of work the same as a person at work.
Yes.
And they need to get back there.
Yeah. They need to get back to a normal daily living.
While critical surgery is immediate here, there are waits for elective cases up to a couple of months. But the waits are coming down. The public hospital has rented the operating rooms at this private clinic to reduce the backlog. In Holland, patients who wait too long in the public system are allowed to go to the private hospitals where there are no waits.
In a big hospital, it's very long, yes. It's very long. It's about 8 weeks before you can get operated.
So you went onto the internet, found this private hospital,
Yeah.
This is how you ended up here?
Yes, yes. It's very easy.
This is a city with liberal attitudes, sex shops and sex shows in abundance. They flaunt skimpy lingerie right on the street. Pot smoking and possession is allowed. They toke up in cafes in plain view. And there's a big red light district. But when it comes to health, the Dutch are compassionate. Euthanasia is a legal medical procedure here.
It's quite accepted, and there's a big need. Well, a lot of the public asks for it. The public really thinks that we should have the possibility to make an end on our life.
And that's done in the hospital or at home?
At home.
As a member of the European Union, the Netherlands is being pressured to bring its wait list down to no wait. And it's becoming a common practice, as it is here, to outsource some of those waiting patients to member countries to clear the small surgical backlog here.
And Brian's Road to Recovery stories wrap up tomorrow with a look at Britain's healthcare system. Britain has a wait list problem just as serious as ours, but unlike us, they have come up with a solution. The British have struggled with their medical wait lists just as much as, if not more than, we have here in Canada. But they appear to be on their way to fixing that problem. In tonight's final installment of our week-long focus on healthcare in Europe, Brian Coxford takes a look at how they're doing it.
They often refer to themselves as the island apart, a member of the European Union, but not Europeans. And the Brits were a world apart 55 years ago when the government of the day introduced the first universal Medicare program. It brought health care to everyone, irrespective of their lot in life. It was the model for fairness and speedy medicine around the world. But today, British citizens are highly critical of their once praised medical program.
Oh, it's rubbish. We have to wait for far too long.
I have problems with my eyes, and it was a very, very serious problem because I've got a chronic disease. And they gave me an appointment to see an eye doctor in 6 months. 6 months, I mean, you know.
You could go blind.
I could.
The actual system itself, I think, has got bogged down by government.
Bureaucracy?
Yeah, basically bureaucracy.
What's wrong with the National Health Service? The problems in the NHS are the talk of the nation, on the street and in the operating room of Royal Free Public Hospital.
The things that are wrong with the NHS? Well, I think now the Red Army is gone, we are the largest employer in Europe, and we are top-heavy. We are undoubtedly management-heavy. And there's been a lot of emphasis on trying to get value for money and making sure we're getting value for money, but it actually costs money to try and work out whether we are getting value for money.
Sound familiar? He could be talking about Canada. The NHS program was copied by us and many nations in Europe. But more than 5 decades later, the British program, like Medicare in Canada, is tired, waiting lists for surgery are long, and it's not delivering the goods. The Brits, like Canadians, have no idea what they pay for health care. In both cases, it's funded directly out of tax revenue. Like us, the public hospitals don't know what it costs for most operations, and there's big pressure here from those same European nations who copied the program for the Brits to reform the NHS to meet the higher standards in the EU.
British healthcare is undergoing change. As a participating nation in the European Union, its member nations are forcing Britain to adopt a healthcare system similar to theirs. That means over the next 4 years, Britain's going to have to pump billions of dollars into its programs, put more emphasis on private care, and bring its waiting lists down to a manageable level.
Hopefully, I think it's by 2008, we hope to be back up with the rest of them.
Yeah, so there's a real catch-up here.
A big catch-up. This is big money.
The Brits have been falling behind Europe for years. The NHS improvement plan is to increase health spending to $210 billion, up $60 billion or 40%. It will outsource 1 million operations and procedures to private hospitals, increasing private care in Britain from 10 to 15%. The aim? To reduce all surgical waiting lists from GP referral to a maximum of 18 weeks. The public hospitals here are very good with quality and speedy care for trauma, heart, cancer, the big stuff. And they're making big efforts to cut the elective waiting lists as well. Inpatient 12-month waits have dropped from 45,000 patients to 10 in 2 years. But that's not good enough for Europe, where many of the countries have no waiting lists at all.
The comparisons, as you know, you've been around, you've seen the differences between Switzerland, for example, Germany, France, and us. And there is a difference.
And you're being forced to catch up.
We're going to have to catch up. We must be careful, however, because finance is not a bottomless pit.
There's always been a private side to London medicine, most notably here on Harley Street. Now, this is where the creme de la creme, the rich and famous, come shopping for their tummy tucks, their implants, and their facelift. You might call it the Rodeo Drive of private surgery.
The doctors here actually perform all kinds of procedures because in Britain it's legal to purchase insurance or buy an operation to jump the queue. Surgeons in public hospitals who are on salary supplement their income at private hospitals like Wellington and London Bridge.
My team are involved in about 600 a year. We probably have to wait a minimum of 4 months for, and probably 9 months. Yeah.
Your assistant?
Here I saw him last week in the consulting rooms, and he's straight on. This is a time that's suitable to him.
In terms of this being a private hospital intensive care unit, I think we have a very, very good service, and we look after very, very sick patients. Some self-pay and some have insurance that will cover that.
Providing it's
There is a shortage of both doctors and nurses in Britain, so to attack the wait lists in public hospitals, some patients will go to hospitals in Europe, and surgeons from there will fly here to do contract operations on weekends.
As far as I know, the government are quite keen on trying to introduce a system of sort of shared responsibility. In France, you've got the state system, and to some extent it'd be a way of trying to fund ongoing healthcare in the UK, a similar type of system.
In Britain, healthcare has always been a political football, so some are skeptical. However, there is a recipe for change here that should benefit future patients. Billions of new health dollars and reforms, performance-based funding, cuts in the 1.3 million healthcare employee bureaucracy, and choices for patients in public and private care.
So how does Canada stack up among the countries that Brian's taken us to this week? Almost all of the European nations have no waiting lists, no shortage of doctors or nurses. Surely they must be spending a lot more money than we are. Unfortunately not. Look at the latest figures available. Switzerland has got the most expensive system. Each person spends $4,100 a year. In Germany, they spend $3,650 per capita. We are right in the middle of the pack at $3,630 a year, right up there with countries who seem to have a lot speedier care. The Netherlands, where there's absolutely no waiting list for any type of surgery, just over $3,400, less than we spend. Ditto in France, $3,230. And Britain, even with, as we've just heard, a system very similar to our own, they're spending quite a bit less, under $2,500 per person a year. And Tony, that's tonight's Insight.